How are you today?
Very well.
How has your day been?
Very good. I do have to give you a report on a fresh post-op I just got back about 6 hours ago. He came back from abdominal surgery. It was an exploratory lap to stop some bleeding. And he did receive 4 units of blood in the OR. Okay? The background is that he's a 20-year-old male college student. He was in a single vehicle, motor vehicle accident. He was restrained and he hit a tree. He did sustain a closed head injury. It was a coup contre coup. He has some abrasions on his forehead. The CT scan was negative for intracranial bleed and also negative for a spinal cord injury. His Glasgow Coma scale at this time is 14. He's a little confused to time and place and person. Excuse me. He did also sustain a right hemothorax, and he has a right chest tube at this time, and that's to 20 centimeters suction. It put out about 20 milliliters of drainage for me. The drainage was red.
Okay.
His lung sounds, I hear bilateral crackles. It's diminished in the bases.
Okay.
His abdomen, we have a midline abdominal dressing, which is dry and intact.
Did he get staples?
Yes.
Okay.
Okay. I didn't look underneath the dressing because that's the first dressing.
Okay. All right.
The dressing is dry and intact. He has his NPO. The NG tube is to low intermittent suction. It drained for my ship so far 200 milliliters of green, light greenish drainage.
Okay.
Bowel sounds are negative at this time.
Okay.
He also has a Foley to bedside drainage.
Okay.
The urine output, since he's been back here, has been 300 milliliters. It's clear yellow.
Okay.
He also has an ecchymotic area to the right abdomen area. Okay.
Mm-hmm.
He has a left jugular triple lumen catheter.
Okay.
He has D5 normal saline with 20 of potassium, and that's running at 125 an hour
Okay.
via pump. His labs were all within normal limits. We're all good there.
Mm-hmm.
He did have a blood alcohol level of 0.8. His urine drug screen was positive for cannabis and for cocaine. Okay?
Okay.
His vital signs,
Mm-hmm.
right now, temp is 98.9. His heart rate is 80.
Okay.
Blood pressure 130 over 75. Respirations are 20. And his O2 sat is 97% on room air.
Has a surgeon been in to see him?
No, not yet. His mother arrived shortly. She's at the bedside now. And as far as I know, she hasn't spoken with the surgeon either.
Okay. How has his pain been on your shift?
His pain has been under control.
Okay.
He's reporting that the pain level is like was 5, and when after pain medication, he reported a relief of a level of 2.
What is he getting for pain?
He's getting morphine.
Okay. And that seems to help him?
And that seems to help.
Okay.
Okay? I've only had to give it to him one time since he's been here on our floor.
When was the last time you gave him?
The last time was 2 hours ago.
Okay.
The plan for today is to encourage incentive spirometer use.
Okay.
They also would like to get him out of bed and to keep checking the bowel sounds.
Is he on any antibiotics?
Yes, he is. He's on 2 antibiotics. He's on Ancef and Unison.
Okay. Okay. Anything else?
No, I gave you the background. I gave you the situation. We know what his goals are for today. And we can go in now, and I'll introduce you to the patient and to his mother.
3.
Hello, Mrs. Martinez. This is Janita.
Hi.
She'll be the nurse taking excellent care of your son today.
Oh, okay. All right. How are you?
I'm good, thank you.
Okay.
And this is George.
Okay.
Okay.
Is there anything we can do for you before
Well,
we leave?
I did have one question. You know that we are Jehovah's Witnesses, and I just wanted to ask and make sure he didn't get any blood during surgery. I haven't seen the surgery.
Oh,
yet.
no, he didn't.
No?
Isn't that right? We'll be back in a few minutes, okay?
All right. Thank you.
Thank you.
3.
What should we do? Should we do the right thing?
I don't know. I wasn't the one that gave the blood, so I don't really care about it. The doctor can deal with it.
I
Or the
wasn't here.
surgeon.
I'm going home. Good night. Good
Night.
luck.
All right.
Oh my God! Did you see that guy Tom Johnson in 202?
Yeah, what about him?
Oh, he looks so gorgeous. I want to give him my number.
Oh, I would not give him your number
Why not?
because he has a huge herpes lesion. I would not give him your phone number.
Is that Thomas Jones? That's my boyfriend. You mean to tell me he has herpes? He didn't tell me about it. That lying leak. I don't know. We talked to him.